Hello, everyone. Welcome back to my channel, Niseri Missions, where we focus on disability and the myths and stigma surrounding disability in Africa. Today, we're going to be talking about a common neurological disorder in Africa that people still need to be educated and awareness to be created so they understand how to help people living with this form of disability, epilepsy. I'm going to start with defining epilepsy, tell us about the types of epilepsy, the causes, diagnosis, treatment, and thereafter we're going to be diving straight into the myths and stigmas surrounding people living with epilepsy in Africa. What is epilepsy? What do you understand when you hear or you know or you have a relative that is living with epilepsy? Epilepsy is caused by excessive neuron discharges in the brain that causes recurrent seizures. Neurons are responsible for transmitting or the transfer of electrical signals in the brain. In the case of someone living with epilepsy, they tend to have excessive or exaggerated form of electrical discharges in their brain that results in them twitching their hands, staring blank, or other forms of manifestations of epilepsy, in which I'm going to dive into right away. What are the types of epilepsy? The brain is divided into two parts. We can have epilepsy as a result of one part of the brain being affected or both parts of the brain being affected. When a part of the brain is being affected, we call that partial or focal form of epilepsy. But when you have both part of the brain being affected, that is the generalized form of epilepsy. I'm going to start with the partial or the focal form of epilepsy. The partial epilepsy can be further divided into being simple or complex. Simple just means the person doesn't lose consciousness, while the complex one, the person loses consciousness. In the case of someone that has partial epilepsy, some of them are even aware. They're able to tell you what happened during the event. And in people like that, you find some of them just have, just jerking of just one side of their hands or twitching of just one side of their hand. Why in the case of generalized form of epilepsy or epilepsy that affects both part of the brain, you have different types, subtypes here. You have what we call the tonic-clonic. That is the one that majority of people understand, where they have the jerking of their hands and also of their legs and shaking. You could also have the tonic one as well, where the person just becomes pretty much stiffened. And you have the atonic one where the person just becomes fluffy, like they just suddenly drop their head. And of course, the clonic form and the myoclonic form where you have jerkings. You see these people jerking their hands. And you have what we call the absurd kind of seizures, where the person is active and all of a sudden they just start staring. This is a kind of seizures that tend to be missed because people don't understand what's going on with those people. And that is why it's absolutely very essential that we educate people on epilepsy and the symptoms and signs to look out for. So when people that have epilepsy, they have what we call the aura. Aura just simply means that some people are able to tell you they know or they can feel when they're about to have epilepsy or seizures. Some people tell you they're able to smell. They smell something abnormal. Some people tell you they're able to see something coming towards them before it happens. And afterwards, we go into what we call the ictal phase. The ictal phase is when they really have the seizures, either they're twitching their hands or their legs. You see some of them bite their tongue. Some of them pee on themselves. They poo on themselves. Some of them even foam from the mouth. And this typically lasts few seconds or few minutes, typically less than about 1 to 2 minutes. And that's when I'm going to talk about when it becomes a concern when this goes on for so long. That's why it's essential when somebody is having seizure around you that you start to time this person. And after the ictal phase come the post-ictal phase. That is after the seizure has stopped. And those people, when they wake up, they tend to be confused. Some of them tend to have headaches. Some even have paralysis of one side of their body after having seizures. So, what are the causes of epilepsy? Number one, it could be as a result of infection. For people that have had meningitis, they have had encephalitis, part of their brain tend to have this irritation that causes seizures. It could be as a result of stroke in the past. For people that have had stroke in the past, it could be as a result of tumor in the brain. It could even be as a result of electrolytes, metabolic imbalances as well. But in all of this, about 50% of the causes of, of the cause of epilepsy or seizures is still pretty much unknown. There are so many things that increase your risk of having seizures. This include brain injury, either as a result of trauma or prenatal or even during antenatal in the process of giving birth to a child. Some people is because for people that have seizures, when they don't get enough sleep, that tends to provoke their seizures. For some people, it could even be stress when they're under a lot of stress. And of course, if you're already diagnosed with epilepsy and you're not using your medications, you're not taking your medications, that makes you prone to having recurrent seizures. And epilepsy typically is diagnosed when you come to the hospital, they put what we call EEG on your head, and that's just a big name whereby an electrical electrodes are being put on your head to monitor for abnormal electrical discharges. In some cases where we suspect that this person has a tumor or an infection, of course, we definitely run blood tests and we get CT scan as well to make sure we're not missing anything in this patient as well. So, what are the treatments available for people living with epilepsy? We have the medical treatment. We have the surgical treatment as well. We also have diet in some cases. So I'm going to start with talking about the medications. The medications that we have, they are called the AEDs. They are just anti-epileptic medications or drugs. And please go and see your doctor, your neurologist. They will prescribe a medication that will adapt to your needs, because some medications cannot be given to pregnant women. Some medications you cannot take if you have severe form of kidney disease or liver disease as well, because these medications, they do come with their side effects. So make an appointment to see your doctor if you've been having recurrent seizures. It's absolutely very important that you do that. In some cases, ketogenic diet has been recommended. It's just a diet that is high in fats. So the brain uses this fat because when this fat is broken down, it gets broken down to what we call ketone bodies. So that's what the brain uses instead of typical glucose. Research is still going on that. There's still a lot of facts to be found out about that. In some cases as well, electrical or surgical intervention, whereby the foci that is responsible for discharging excessive neuronal discharge is being identified, and they're able to either take it out or they're able to implant to stop or to reduce the excessive neuronal discharge. So now we're going to dive right away into the meat. But before we dive into that, I just want to make you aware of a severe form of seizure, which is called status epilepticus. When you start timing a patient or a person living with epilepsy, and this person goes on and on and on, back to back without coming back to baseline for over 5 minutes, please take this person straight to the hospital for checkup, to the emergency center. So let's address the myths and the stigma surrounding this epilepsy in Africa. Unfortunately, a lot of work still needs to be done in Africa because people with epilepsy are seen as people having communicable disease, contagious disease. That is absolutely not true. Epilepsy is not contagious. You're not going to catch epilepsy by touching someone with when they're having seizures. They need your help. They need my help. And epilepsy does not run in the family. Stop the stigma. Getting married to somebody with epilepsy doesn't mean you're going to have a child or a baby that has epilepsy. The other thing I'd like to address is when someone is having seizures, there are things that needs to be done. Do not run away from those people. Number one, secure their environment. It breaks me when I see that people had seizures and they fall to their death. Why? Because their environment is not being secured. Remove sharp objects. Keep them away from dangers around them. Make sure that their airway is secured. Please and please do not shove anything into their mouths. Do not put spices into their eyes. It is not witchcraft. People need to understand this. You can put a pillow behind their neck, make sure that their airway is secured, and start timing as well. By the time it resolves, you can put them in what we call a recovery position. Put them to their side. And afterwards, those people can seek help in the hospital and establish a relationship with a neurologist that would follow them through with managing seizures or epilepsy. So once again, I just want to create this awareness that these people are not witches. Again, they are not cursed. It doesn't run in the family. You cannot communicate epilepsy by making contact with these people or by marrying from their families. In schools, we need to educate the children. We need to let them know the causes and the fact that this is not contagious. The bullying, the stigma of people living with epilepsy has to stop. Join me today to create this awareness. Thank you very much for joining us. I appreciate your time. Once again, I want to thank our sponsors, Sabini Villas. We appreciate you. If you're based in Nigeria and you're interested in buying property, Sabini Villa is a tested and trusted property company. You can reach below the video and you'll see their link over there. Thank you once again, and I'll see you next time. Bye.